So I'm currently a student in the UBC Vancouver Bachelor of Science in Nursing program. It's currently summer break right now. I just recently finished the third semester of this 5-semester program. I thought it would be a good idea to talk about admission tips, tuition, how this program is structured, and my thoughts so far. When I applied in 2019 for 2020 entry, I had to send in my previous university transcript, write a supplemental application, and then write the CASPer test. So it seems like they're updating some requirements for 2022 entry, so be sure to check out the UBC BSN website for the latest updates. The prerequisites when I applied, we needed to have 3 credits of English, or that could be waived if you completed a previous university degree where the main language of instruction was English. And then you need to have 6 credits of anatomy and physiology, which need to be taken within the last 4 years of the time of your application. So it's okay not to have previous healthcare experience. The people in this cohort come from a variety of backgrounds. Some people in the cohort were already healthcare professionals in a different field. Some were completing a university undergraduate degree and then transferred to this program. What is important is that when you answer questions on the supplemental application, it's important that you talk about the skills that you learned and developed from your previous work experience, extracurricular experience, and volunteer experience, how these experiences and skills will make you be a great nurse. So as a very simple example, let's say you work as a server at a restaurant, and as a server you come into contact with many customers every day, so you're great at socializing and connecting with people. So on the application you could talk about that you are really good at socializing and also great at connecting with people, and that will help you be a great nurse because you have to interact with many patients, and then you can connect with patients, and you also need to work with many healthcare professionals as a nurse. So being a server will help you be a great nurse. So that was a very simple example, but I just want to say that don't worry too much about not having previous healthcare experience. The more important point is that how you frame your previous experiences and how that will help you be a great nurse. So in terms of CASPer, I would say the first important thing is to get up your typing speed. I would say a typing speed of around 90 to 100 words per minute is sufficient. So on the CASPer test, there are 12 sections. 8 of those 12 are video scenarios, and 4 of those 12 are word-based scenarios. So after you view each scenario, you will have 5 minutes to answer 3 questions. And that's why having a quick typing speed is so important. So I would say try to find as many practice questions as you can online, and then try to simulate as if you were taking the real test, so that when the actual day comes, you won't have any trouble with the time. So when answering CASPer questions, I always found this format quite useful. So first you would identify the problem or the issue in the scenario, and then second, you would always acknowledge that there are multiple perspectives to this problem. Third, you would describe what is your responsibility as pertaining to your role in this scenario. And then fourth, you would say that what you would do to help solve this problem in this scenario. So you would use if and then statements. For example, if this is the case, then I will do this. And then lastly, you want to always provide a rationale as to why you're doing what you are doing. So it's important to remember always to remain non-judgmental in all your answers and to never assume in your answers. In terms of tuition for the first semester was around $4,000, and then for the second semester is around $3,300. For the third semester is around $3,000. For the fourth semester it will be around $4,000, and then the last semester it will be around $3,000. So the total is around $17,300 for around 20 months. So there's extra costs as well. For example, you'll need to get an N95 mask fitting and also a CPR certification, and you'll need to renew it every single year. So that costs around $130 and maybe a little bit more. You'll also need to buy online programs such as Shadow Health, which is a digital simulation of interactions with a patient at a hospital. You'll also need to get something called Safe Medicate, which is to help you hone your skills in practicing calculating doses for medications. So those two programs will cost around $300 together. And then there are other fees such as textbooks, stethoscopes, and also scrubs. The UBC Vancouver Nursing program is an accelerated program that runs over the course of 20 months and is divided into 5 semesters full-time. So there are usually around 120 students in the cohort. In the first semester, we learn medical surgical nursing. In the second semester, the cohort will be split in half. Half of the cohort will learn about community nursing and also mental health nursing. The other half will learn about maternity and pediatric nursing. For the third semester, the cohort comes back together and then we learn about more medical surgical nursing. In the fourth semester, those who took community nursing and mental health nursing in the second semester will now take maternity and pediatric nursing. And those who took maternity and pediatric nursing in the second semester will now take community nursing and mental health nursing. And then the last semester is preceptorship. So before I go into more detail, it's just important to note that for my semesters 1 to 3, they were entirely online. And the only things that were online were some lab sessions and then clinical practice. So as we're returning to in-person in September, my experiences may differ from yours when you enter into this program. So a typical week for me after we finished labs were that we had 3 days off, 2 days of lectures, and then 2 days of clinical practice. I think before COVID hit, the usual schedule was that the cohort had 2 days off, and then there's a lab every week, and then they have 2 days of clinical practice and then 2 days of lectures. In the first semester, the cohort takes 4 lecture courses. So one of them is a Foundations to Nursing lecture course. The second one is a Medical Surgical Nursing lecture course. The third is a Pharmacology lecture course. And then the last is a Relational Practice lecture course. We also had 1 laboratory course and then 1 clinical practice course. So the clinical practice was in mostly long-term care and also on subacute and acute units in hospitals. So for our labs during COVID, we had 2 to 3 lab sessions, and each session was around 5 to 6 hours before clinical practice starts. Under normal circumstances, I believe that labs were every week and they were also shorter. For the first semester in clinical practice, the important skills that we learned were head-to-toe assessments, personal care, wound care, medication administration, the 7 rights and the 3 checks, and also oral medications, subcutaneous medications, insulin as well. We also learned about donning and doffing PPE. So in the first semester, clinical practice started in October and lasted until December. We had around 8 weeks, and each week we had 2 shifts. Each shift was about 8 hours. However, there were a lot of statutory holidays from October to December, and there were some weeks where we only had 1 shift per week. For the second semester, I was in the community nursing and mental health nursing route. So I had 3 lecture courses. One was the mental health nursing lecture course. The second one was the community health nursing lecture course. And then the third course was a research course, and actually the whole cohort takes it, and it was the only course that the whole cohort takes in the second semester. We had 2 lab sessions before entering clinical practice. Clinical practice for community was mainly in home health and also public health. For mental health, we were mainly in hospitals. This semester, I got to work on priming IV lines, administering IV medications, administering IM injections, and also performing the MSc, which is the mental status examination for mental health. It's a type of assessment specifically for mental health. I was in public health, and we helped out at a COVID immunization clinic, a COVID rapid testing clinic, and also a community local clinic. Clinical practice started in January and ended in April, and it spanned over 10 weeks. Every week there were 2 shifts, and how this would work was 1 shift would be for community nursing, and then 1 shift would be for mental health nursing. So similar to the first semester, each shift was around 8 hours. In the third semester, the cohort comes back as 1, and we continue to learn more medical surgical nursing, building upon what we learned in the first semester. So we had 3 lecture courses in the third semester. 1 was medical surgical nursing, but building upon what we learned in the first term. The second course was about leadership, informatics, and technology. And then the third was about complexities in senior care. We had 2 lab sessions before going to clinical practice. Clinical practice was all in acute care hospitals. So most of the selections were usually on medical or surgical units. For this semester in clinical practice, our scope of what we could do as students increased drastically. So we could do everything that we did in the first semester, but now we could also do inserting subcutaneous butterflies, inserting Foley catheters, inserting NG tubes, performing tracheostomy care, administer IV push medications, and also perform saline lock. Clinical practice started in May and ended in July, so we had 10 weeks with 2 shifts every week, and each shift was now 12 hours. So I haven't finished the 4th semester yet. I will be going to the 4th semester in September. However, I will be doing maternity and pediatrics. So I will have 3 lecture courses. 1 is about maternity nursing, the second is about pediatric nursing, and then the third class, which the whole cohort will take, and that's the only class that the whole cohort takes together, is about Indigenous health. I think this time, since we're going back to in-person, labs will be every single week and will be shorter. Clinical practice will be at hospitals and will be 10 weeks, starting from September and ending in December, and there will be 2 shifts every week. 1 shift will be for maternity nursing and 1 shift will be for pediatric nursing. For maternity nursing, shifts will be 8 hours. For pediatrics, depending on where you are placed, it will be either 8 hours or 12 hours. In pediatrics, you'll be doing physical assessments and the ASQ, and for maternity, you'll be doing pre and postpartum assessments, and also along with newborn assessments and care. In the last semester, it's all about consolidation of what you have learned over the past 4 semesters. There's a lecture course about leadership, a lecture course about consolidation of nursing practice, and then a lab course. So these lecture courses and then the lab course will run for about 2 months, and then for the last 2 months of the semester will be focused entirely on preceptorship. Since this program is accelerated, there's a lot to learn, and also there's very limited time. For me, I found the first and the third term to be the hardest. For the first term, it's more about getting used to nursing and starting to think like a nurse. So my previous degree was in science, and usually in a science undergraduate degree, many of the exams will have a lot of memorization-based questions. For nursing, usually the questions on exams are mostly application. Nursing is a lot about focusing on what is the priority for the patient, what are the interventions that we can do as nurses, and then what are the outcomes and how do we evaluate if we've been successful. Definitely there are a lot of things to memorize as you learn in a nursing program, and for me, clinical practice was also a lot to get used to. With an accelerated program, I felt like we were really just thrown into clinical practice, and then we had to work hard and we were pushed to develop our critical thinking skills and our practical skills. I found that it was a large learning curve in the first semester, but after the first semester, I kind of got used to it. Also, in the first semester, we had 4 lecture courses compared to the second and third, where we only had 3 lecture courses. So there were more assignments, tests, and more things to do. The third semester has definitely been the hardest. So we as students began to have more responsibility than we had in the third term, and we could do more practical skills at the hospital. The units that we were placed in for the third semester had patients that were more complex and acute than the patients that we encountered in the first semester. For the third semester, a lot of expectations were placed upon us, and I think the majority of the cohort were really tired and burned out. I think the exhaustion came from having to do 2 12-hour shifts every single week and then having to attend online lectures. Definitely online school has been tough. For some classes, there were a lot of discussion posts that we had to write on certain weeks, and then we had to write response posts, which sometimes got a bit repetitive. Other times we had other modules to complete, and sitting in front of a screen for a long time is really hard. Some days we would have 6 hours of lecture, and then after 6 hours of lecture, we would have to go work on homework on the computer. And so we would probably be on the computer for more than 8 hours in one day. The professors and instructors that I have encountered so far throughout this program have always been very supportive and caring for student learning. They really want the cohort to be successful, especially for the third semester. Clinical practice was quite difficult. I attended lab sessions every week, and the lab instructor there was very helpful and gave me great advice and feedback. Back when I was studying science in my undergraduate degree, I felt like I was always competing with my classmates, but in this nursing program, I feel that we're just trying to help each other succeed. That's all I have to say. If you have any questions, let me know, and I'll try to answer them. Thanks for watching.